Hi, everyone. Thank you for attending our virtual dental shadower session today. We want to remind you that in order to get your hours, you will have to take a short quiz. And as long as you get 3 out of 5, you will earn your hours. The quiz link will be located in our link tree, which is in our Instagram bio. All right, let's get started. We are very fortunate to have Dr. Ashkan Namini for today's session. I am handing the mic over to you. Feel free to start whenever you want.
Thank you. I appreciate it. Very flattered to do this presentation, and thank you guys for setting this up. So my name is Ashkan Namini. I'm a dentist here in Southern California. So I'm a general dentist, but as many general dentists do, I do a lot of specialty work. I do root canals, we do wisdom teeth, I place implants. I don't do traditional braces, but we do Invisalign. I grew up in Seattle, Washington, went to undergrad at the University of Washington, but came to the University of Southern California for dental school, which is the most expensive dental school in the country, unfortunately. I work in Bellflower in Southgate, California. For those of you who are not familiar with the Los Angeles area, it's basically right next to Long Beach, just more inland. Some study tips and advice on staying motivated. So, some of you I think that are listening in are, pre-dental. Some of you might be pre-doc in dental programs. I went to a big school, University of Washington, 40,000 kids, undergrad. So it's very competitive. And I understand that a lot of you, at times you'll feel, a little overwhelmed, a little unmotivated and whatnot. And I think one of the biggest things I can suggest is, develop good study habits, as cliche as it is to say. Don't wait till last minute to do a lot of things. Don't study last minute. Don't do your homework last minute. It's just good for your sanity. Find good study partners. I think that was the biggest thing for me is, I have a difficult time listening to lectures and, trying to study on my own. I think when you can bounce ideas off of classmates and whatnot, it's far more rewarding, and it's just a better learning experience. Some people might be different, but I think in general, it's much easier in that sense. I asked upperclassmen for study guides. I know when I was an undergrad, I lived in a fraternity, and a lot of my upperclassmen took the same classes that I was taking, and their study guides are invaluable. It's a lot of it is relevant questions, maybe questions they've used in the past. I know a lot of you are taking like organic chemistry, and I know there's labs involved. So, a lot of times those upperclassmen have done the same labs that you guys have. That's the biggest, advice I could give for study tips. For staying motivated, if dentistry is truly your dream, you'll do anything at this point to get to that point, and it's funny. I think whenever I talk to pre-dental students who, are trying to decide whether they really want to do dentistry, or they're telling me like it's so hard to get in and whatnot, I tell everyone, the hardest part about dental school is getting in. I really think like once you're in dental school, obviously you have to study and get good grades and whatnot, but the hardest part about dental school, at least for me, was getting in. And, I only got into one school. I only got into USC. I only had 2 interviews, USC and UW. And, you don't need 10 people to offer you positions in their incoming class. All you need is one school to like you, and that's all it takes. So, if you don't have the best grades, you can score really well in the DAT. If you don't have a great DAT score, hopefully you had good grades or good extracurriculars. And I think one big thing is, there's so much pressure in the US, especially to like have your life figured out and, get into whatever program you can right off the bat. But I can't tell you how many classmates of mine didn't get into dental school their first try, or some of my classmates were like 29 when they started their first year of dental school, or some were like 32. So it's never too late to get into dental school and start your career, as long as this is truly what you want to do. So, it's gonna have the ups and downs, staying motivated and whatnot. But if it's truly what you want to do, you'll get it done. Some other things are just like have a balanced life. Go work out, go travel, read books. I think it's so easy. It's so easy to get burned out just studying all the time or not having a social life that I think is actually more detrimental to your grades and your mental well-being to, prioritize studying and grades as your number one, number two, number three, number four things. Obviously like you want to get grades, but you gotta, have a balanced life. And I think, that's something that I was good at. Obviously I wish I studied a little bit more, but it's definitely possible to have a balanced life. Community service. This is really the reason I got into dentistry. I think, growing up, my parents were engineers. And so, growing up, I was always better at like math and physics. I wasn't so good at biology and chemistry. And in undergrad, I had my moments of doubt, do I want to do dentistry? Do I not? But I went on a dental volunteer trip to Costa Rica going into my senior year of undergrad. And from that moment on, I knew I wanted to be a dentist, seeing the local dentists, giving back to these very rural villages, people that would never may not get dental work for another 5 or 10 years, seeing how grateful they were, I think was really what made me want to become a dentist. And, I hate to admit it, but Americans can be so entitled that, you don't appreciate going to the dentist as much as you should, or you don't appreciate like having a toothbrush and toothpaste as much as we should. But going on a volunteer trip to Costa Rica really opened my eyes. And since then I've made it my goal to go on a dental volunteer trip once a year at least. Obviously with COVID and whatnot, that made it a little bit harder, but I've been to Costa Rica, I went to Fiji, I went to Belize, I've been in Mexico multiple times, and I went to Haiti as well. And honestly, I've traveled, I think, more for dentistry than I have for vacation, really. And, these aren't just dental trips. You're not going there just to provide dental work. Like, it's a cultural experience as well. You're going to villages or rural areas that you would not have if you were just going there to vacation. You see things that you would not have. You bond with the local people in ways that you would not have if you were there to just vacation. So, community service is not just, first and foremost, obviously you're going there to do volunteer work, and it's extremely rewarding. But, it's the cultural experience in itself is an amazing, second aspect of, those community service trips. And these are just abroad trips. I've done so many clinics locally through different organizations, through clubs at USC. So, whatever dental school you go into, I would highly encourage that you get involved in those types of clubs, and it's going to be an extremely rewarding experience to, and you bond with your classmates and whatnot. So there's a lot that can be done in community service. Choosing specialty. So, I'm a general dentist, so I can't really speak on the specialty. I think you guys have another presentation this Friday from a pediatric dentist, but first and foremost, it's grades. All those specialties will look at, your dental school grades, see where your class rank is at if your school has one, and then your exam score. So while you're in dental school, some residencies like ortho, they will have you take the GRE, and you'll get a score for that. There's a new exam in dental school that most specialties are asking for that's called ADAT. And the reason that is because your board exams now are not graded. It's a pass or fail. So it's a pass or fail. So they need some way to measure you against other applicants. So exam scores are going to be a big deal. If you're doing oral surgery, you're going to take a medical dental exam. That's very competitive as well. Other factors like letters of rec, I say it's okay to be a kiss ass. Sometimes it's true. Like it's not a bad thing, join clubs, meet faculty, find good mentors. There's no point in beating around the bush. Like a lot of today's world is networking. It's who it's who you talk to. It's what mentors or faculty can write really good letters of rec from you, and what faculty are in with different specialties at, not only at the school you're at or at, but they may know other faculty that are at schools throughout the country. So, you have 4 years in undergrad or in dental school to, meet faculty and become close with them. And I would say go for it. It can only help you. Extracurriculars, so like I talked about, like some of those different clubs that are at school. I know at USC, I was a founding member of the Sports Dentistry Society. I was part of the Persian Dental Student Association. Different clubs that do volunteer trips as well. So there's a lot of extracurriculars, and and even with specialties, like those extracurriculars will, it's a little bit of a social aspect as well, and that you'll meet classmates and upperclassmen and underclassmen, and it's a bonding experience. So, is there any specialty that you have considered or will consider? So I really like endo. So that is the endodontist is the one that does the root canals. I actually applied last year, but I didn't get in. So, it's a little bit hit on the pride. But, the nice thing about, like, this is what I mean by, the hardest part about dental school is getting in. Because even if I didn't get into endo, I still am a general dentist. So it still works. But I really like root canals, and I really like oral surgery. I like extracting wisdom teeth. I like doing implants. For endo, it's another 2 years. Some programs are 2.5 or 3 years. And then for oral surgery, most of them are 4 years, or it could be 6 years if you wanted to get your MD degree as well with it. So, by the time you're done with oral surgery, you spent a good at least 12 years going to school. But, obviously you go to school that long, you're going to make the most money. But you really just want to find out what you want to do, what you like doing. I despise working with kids, not in the sense that I don't like kids. I actually really like kids, but I just cannot work with them in the dental chair. You have to have some type of patience. Braces, ortho, it's a lot of people do it. It's a really good lifestyle. You don't work, you see a lot of patients, but you're not bending over all the time. Your assistants do a lot of the work. But for me, I like to get my hands dirty. So I like to be more hands-on and whatnot. So that didn't appeal to me. But root canals, extractions, that stuff, I love surgery. So that stuff appealed to me. But the nice thing about being a general dentist is, you can pick and choose what you want to do on a daily basis. So if I want to do wisdom teeth, I can schedule wisdom teeth. But once you become a specialist, you can't really do general dentistry stuff, because the moment you start doing general dentistry stuff, no general dentist is going to want to send their patients to you. So it truly has to be something that, you can see yourself doing for the rest of your life. So something to keep in mind. What a typical day is like. So most common patient concerns, the first thing that they talk about is, someone comes in for pain, they have a big cavity, they have an infection. That's our it's our biggest thing. Aesthetics, the veneers and cosmetic cases are becoming big, especially in LA. A lot of people, unfortunately, due to Instagram and social media, you see these celebrities or models or, what may have you, that have perfect teeth and perfect color and perfect smiles. And so a lot of people, want to get that same Hollywood look. And a lot of patients just need a cleaning. They haven't been to the dentist in a long time. They come in, they're just there to get a cleaning and get out of there. But as a general dentist, you are as much a therapist as you are a dentist. There are times that a patient will want to talk to you for 20 minutes, tell you all about their life, and expect you to be their best friend by the end of it. And that's totally okay if you have the time for it. But, it's a great social aspect in that sense of dentistry. This is the nice thing about being a general dentist is, you could see, you're going to have a patient from the age of, 14, 15 to the time they become 50, 60, you never know. The toughest parts about proposing treatment plans. So treatment planning, aside from patient management, I think treatment planning will be the hardest thing you do in dentistry. Wisdom teeth, implants, cosmetic cases, they will not be as hard as treatment planning, because, you could ask 100 different dentists about one patient and you may get 100 different answers. It's truly remarkable, the variability and, treatment plans that you can get from one case. Obviously, the simpler cases, you're not going to have that same variability. But when you get to tougher cases, there's so many ways of going about it. And a lot of it depends on how you were trained, what school you went to, what CE courses you've done. But that is the hard, and it's what patient wants versus what the patient needs. A lot of patients will come into the office thinking they're just going to get a cleaning, maybe a couple fillings, but you look at the x-rays and whatnot, and they need 5 crowns, a couple root canals, a couple teeth taken out. Like, it's a tough conversation to have with patients because, a lot of them weren't expecting, and it gets expensive, and it's tough because, dentistry, the cheapest dentistry is just brushing your teeth. And that's what I try to explain to patients is, once a filling costs a certain amount, once the cavity gets bigger, you need a crown, that costs more. And once that gets bigger, you need a root canal, it costs more. So, the cheapest dentistry that you can provide to patients is just having them brush their teeth and get regular cleanings and regular checkups. But it's a tough conversation to have with patients because, obviously they can decide what treatment they get because it's their mouth, but you want to make sure that it's very clear, what teeth are priority number 1 and what teeth we can wait on. So that's the tough part about treatment plans. So I have a few cases. So some of these are completed all the way. Some of these I'm in the process of completing. So this is my first case. This is one of my patients. So, obviously he's missing a lot of teeth. He's got some chipping, it looks like grinding habits. He's not biting on many teeth. The ones that he's left biting on, he's got some lesions, what we call abfraction lesions. If you look, the patient's right side of the mouth, you have this tooth, which is number 7. So 6 and 7 we pulled here. And we basically did a bridge from tooth number 5 to tooth number 8. And we did single crowns 9, 10, 11, and 12. And you look at a smile from before we started to a smile after, it's night and day. Even though you can't see his eyes, you can just tell in his facial features how big of a difference this has made. He looks 10 years younger just from fixing his smile. And then the bottom teeth, our goal is that we're going to do a big bridge here. That's going to be connecting all the bottom ones, going to kind of replicate what we did with the top ones. So we can fix the bottom, but again, it's a money thing, this is not cheap. So he, did the top and he's waiting on the bottom so he can save up some money. So a really cool case. He loved it and he, made him want to do the bottom even more. So this is what I mean, but I like doing surgeries. A lot of general dentists may pass this on to an oral surgeon who will take care of it. But basically what you see on the tip of his tongue is a lesion here. And this is what we call like an irritating fibroma. So basically what happened is, however many years ago, 5, 10 years ago, he bit his tongue. And basically this is the way the tongue healed. It caused, the healing process caused like excessive scarring and tissue proliferation in this area. And he's had this for 5 or 10 years. At one point you just get used to it and there's, it doesn't become bothersome. But, for me, I like doing this. So I told him, I could definitely take it off for him. So you can see we basically just numbed the tongue just circumferentially around the lesion. And I just took a blade and I basically held the fibroma up from the top and just cut elliptically underneath the lesion until I felt like I got the whole thing out. And this is about 4, maybe 6 weeks later, and you can see how much it's healed. And it looks great. It looks like any normal tongue. He's ecstatic about it. So I think it healed really well and it hasn't come back. As long as he doesn't bite his tongue again, it shouldn't come back. I don't think it's going to be an issue. But this is a really cool case because you don't do this very often as a general dentist. Obviously, you do the crowns and bridges and whatnot, but things like this is a fun case. This is one of those cases that I was saying that I'm in the progress of doing. So this guy, obviously you can see his front teeth here. He has problems in the back, but this is kind of not only a cosmetic case because it's the front teeth, but obviously it's a restorative case. You can see the cavities, the black spots. You can see a lot of teeth broken down. the cool thing about this case is it involved, root canals and crowns as well. So you can see, like, for instance, number 10, which is this tooth here. Some people might have wanted to extract it, but I thought we could save it. So I did a number of root canals. So I did a root canal on 7, a root canal on 8, and a root canal on 10. And then what I did is I just removed all the cavities completely. I built up the teeth, what we call buildups. And this picture is the day that I prepped them for crowns. So I already delivered the crowns, but I wanted to give them a few weeks for the gums to heal after the delivery, so I could get a better picture for Instagram, selfishly. But it looked great. He looks fantastic. I'm just gonna give him a few more weeks. This is another cool case. I had some more pictures, but I, for some reason, could not upload them. They were saved in a different format. But this is another one of those surgery cases. So this is what we call a mucoceal. So this patient bit their lip at some point, and they formed this kind of like bubble. It's a fluid-filled sac, essentially. And what it is, a mucoceal is a blocked salivary gland. So underneath this, is this bubble or sac, fluid-filled sac. And she bit it a long time ago. It went down, but she had bit it again, like maybe a week before she saw me, and it got big again. So she was like, she gave up at that point. She was just like, I need to just get this removed completely. So we numbed the lip, and basically this is a little bit more technique sensitive, because what you have to do is you have to use a blade to cut across the top of the fluid-filled sac. But you do not want to put the blade deep enough, because if you put the blade too deep, you're actually going to cut the sac and it's going to disperse, essentially. But you want to take it out in one piece to make sure you remove the entire thing as a whole. So you cut just barely above the top of the bit, and then you use scissors. And it's funny, you don't use scissors the same way you would imagine in the cutting fashion. You actually use it the exact opposite. So instead of cutting down, you're opening up with them. So you can kind of see it in that third picture on the right. You can kind of see how I'm trying to open it up, which releases the tissue of the lip from the actual fluid-filled sac. And eventually I just got this out, and I thought I had the picture from before, but no, I don't have that. But it came out really well. The whole sac came out as a whole. You can see how big it actually is. It goes down deep into the lip. We put a couple sutures in, and I saw her back about 3 or 4 weeks after. Well, 1 week after to see how she's doing, and then 3 or 4 weeks after to see how the lip healed. But this is another cool case you don't do very often as a general dentist. I've only done this once in 2 years. So, but again, that's the nice thing about being a general dentist is you get to do a lot. You get to do whatever you want, essentially. Obviously, you want to make sure you stick to your skill set, and you don't want to do anything that may risk the health of the patient. But as long as you take some CE courses and talk to the right people, you can do cases like this that a specialist might not do, because it's not in their specialty, their realm of specialty. So, some pretty cool cases. And that's about it, really. If you guys have any questions or comments, I would love to answer them.
Yes, thank you so much for your presentation. So I do have a few questions in the Google Live chat. So the first question is, how do you deal with stress or manage work and life balance?
That's such a good question. Honestly, I have grown so many more gray hairs since I started working as a dentist than I would have thought. With stress, everyone has a different way of dealing with stress. For me, I love working out. I love playing sports. So the thing about being a dentist is I'll do an extraction one day, and you are always like, I go home and I'm like, damn, I hope they're doing okay. I hope they're not, in too much pain and whatnot. But you kind of have to just, you have to force yourself to separate work from home. The moment I get home, I want to go to the gym, or I want to go play soccer or play basketball. And that helps with, dealing with that stress and whatnot. a lot of other times, the best way to deal with stress is vent, call a classmate, or I call one of my classmates, or I call a mentor and I vent to them about the situation, or we bounce ideas off of each other. And I think that's a really good way of dealing with stress. If you're cook, go home and cook, if that takes your mind off it, or go home and, talk to friends, or, whatever it may be, that, or read a book, that helps you deal with stress. There are different coping mechanisms. I think, everyone here was an undergrad and was stressed out at one point, and you dealt with it a certain way, and those same ways will work in dental school as well. So dental school and work after school. So there's, whatever you're most comfortable with, but that, for me, it's sports and working out.
Mm-hmm. Okay. So the second question is, what is your favorite procedure to do?
Favorite procedure? I really like root canals. Obviously, I applied to endo, so I really love root canals. But I think honestly, I love extractions. It's always a challenge. How do you get this tooth out? I love doing wisdom teeth, because a lot of people come to the general dentist not expecting you to do the wisdom teeth. They expect to be referred to a specialist. But I love doing wisdom teeth. And, the more implants I do, I love implants as well. You're literally putting a screw into the bone of a person's mouth, and you're giving them a crown, and you're literally giving them a whole tooth back. So I think if I had to pick anything, it would be extractions, but I love root canals and I love implants as well.
Okay. So another person in the chat has asked, how do you stay motivated to overcome rejection, especially when choosing your specialty?
Oh, God, that's a really good question. And honestly, I've been dealing with that ever since I applied. I'm a very prideful person. So it has been a little bit difficult because, I could apply again this year, but I chose not to. Maybe a little bit out of pride, but maybe realizing that that's not what I want to do for the rest of my life. And I think that's a big way I dealt with that rejection is, I'm a big believer of, if it's not meant to be, it's not meant to be. So, not getting in, it stung initially, but I think in the long run, it was just not meant to be, or it was not the right time. And that was the way the world wanted to tell me, or life wanted to tell me that it wasn't. But honestly, a lot of it too is I use it as motivation to just become better. I took different CE courses. I started focusing a lot on extractions and cosmetics. And I think I've realized that I love general dentistry because I can do different procedures. And, it is a blessing in disguise. You just have to realize that anytime you have a rejection in life, you either use it as motivation or you let it get to you, and it's going to bother you for a long time. But in this case, I just use it as motivation to focus on other aspects.
Mm-hmm. So another question is, I'm worried about not having good manual dexterity. How do you suggest I improve this?
That's a really good question. So when you first get into dental school, there will be some people that right off the bat will be better at preps than other people. And that's nothing to be ashamed of at all. The biggest thing is just practice. And that's when you're in dental school. I think your question is, coming into dental school, how can you be better? I think for me, this is so funny. I grew up playing basketball, and I remember one of my coaches telling me, like, I'm right-handed. So he's like, if you really want to get better with your left hand, do things with your left hand. So from when I was in high school, I started brushing my teeth with my left hand. And it's subconscious. So now I only brush my teeth with my left hand without even thinking about it. I even started eating like my cereal with my left hand. And this is in high school. And I think my mom was extremely upset with me for like 2 weeks because there was so much spilled milk over the kitchen table. But I think little things like that help. Take art classes. I think painting classes, drawing classes will be extremely helpful. Some of my classmates, I think some of them took and this is not in preparation for dental school. It's just things that they did as their own hobbies that have helped them in the long term. Some of them were artists. Some of them love sewing, little things like that. But I wouldn't worry too much about it. When you get into dental school, you will have so much time to practice. And if you really want to be a good dentist and have, great manual dexterity and clinical skills, then you will practice and you will make the time for it. So I wouldn't stress too much about it, but there are little things you could do.
Mm-hmm. The next question would be, how do you cope with patient expectations?
Mm-hmm. So, you want to obviously take their mindset and their expectations into account, because, you know, they have a chief complaint and that's what you want to deal with. But you have to be real with them. I think in today's society, we try to like baby people and sugarcoat things a little too much. I'm a little bit more upfront as a dentist. I'll walk into a room, and if I see a lot of teeth with cavities, I will literally tell the patient, like, I'm not going to sugarcoat it. You are not in great shape. And I think your patients will appreciate the honesty more than anything else. You know, they're adults, you know, they're 20, 25, 30, 35, 40 and older. You know, they would rather you be honest with them. And I think you being honest with them up front actually saves you in the long run as well, because, you know, I've heard about so many stories where a patient came in, the dentist said, oh yeah, all you need is a filling. And that filling turned into a root canal and a crown and whatever. And, you know, the patient lost trust in the dentist because they had no idea that it could come to that result. So I think managing patient expectations just by being upfront with them and honest with them from the start is probably the number one thing you can do.
Okay. Is there something you wish you'd done differently in dental school?
In dental school? Honestly, this is going to sound really weird. I wish I would have kissed ass a little bit more. At USC, a lot of it is about politics and whatnot, and some of the clubs. And I am a very prideful person, so I don't like stooping down to that level in a sense. But there were, to a degree, I wish I would have like kissed ass a little bit more. But in terms of like studying and practicing and having a social life, not at all. I think I studied and practiced as much as I needed to, and I had a social life. I went out on the weekends and whatnot. I think I was the definition of, you know, work hard, play hard, but I still got my shit done. So in terms of that sense, no, but in terms of like, you know, the politics of school, maybe a little bit more.
So another viewer has asked, what is your most favorite experience, your favorite volunteering experience?
Oh my gosh. Okay. Well, I can't ever say one is the best because they're all so different, and every country I went to is so different. So I went to Costa Rica. I'll always have a soft spot for Costa Rica because it was my first volunteer experience, and it convinced me to want to be a dentist. And Costa Rica is amazing. We went into a village that had no running water, and it was just, I've never seen people live like that before. So it was a very eye-opening experience. We also spent 2 nights living with the host family, so it was so cool in that sense. So Fiji was amazing, the most beautiful place I've ever been to, so that was awesome. Belize, again, a beautiful place. I think that was probably the most like, you know, we did the dentistry for like 4 days, but we had a lot of fun for 3 days after our 4 days of clinic work was done. So I think that was like the most, you know, partying fun. And then Haiti was probably like the most, it's hard to explain Haiti. Haiti is the dirtiest country I've ever been to in my life. But the people might've been some of the most appreciative people I've ever met in my life too. So, and I went with just one of my really good friends on that trip. So I think it was a good bonding experience in that sense, but all of them are so rewarding in their own way. So I can't say one is better than the other or whatnot. I appreciate all of them.
Okay, so we have one last question here. Have you ever seen someone come in for veneers when they were clearly too young or their teeth didn't need the procedure, but they wanted it for aesthetics?
Really, really good question. Yes, I have. And I've actually turned I've only been working for a couple of years, but I've turned a few patients away who wanted veneers when I really don't think they needed it. And, you know, their teeth were perfect. You know, they were straight. They were, they weren't chipped. They didn't have cavities. I think for one of them, I just encouraged them to get a whitening, and I think that made a big difference. And the thing with veneers is a lot of patients will come in who want veneers because they have some crowded teeth and some teeth that are like not in line with each other. And I think the best thing you can do for those patients right off the bat is, you know, tell them to do braces or Invisalign. Because I think once people straighten their teeth out, they will see that they like the shape of their teeth and like the aesthetics and the form of it. They just needed them to be lined up essentially to make a big difference. So I have had a few patients that have come in wanting veneers when I really think they didn't need it, and I have turned them away. Obviously that doesn't help me in the bank account, but I can sleep at night knowing that I think I did what's best for the patient, and I'll tell them like, hey, I don't want to do this. I don't think you need it, but I can refer you to another dentist that might be interested. And, but there are cases like that for sure.
Okay, so that was the very last question. Thank you so much for taking the time to talk to us about your profession. It's truly appreciated, and I know I learned a lot from your presentation. And to our viewers, just remember that we have a quiz that will stay up for 24 hours. You can find the link in our Instagram bio. And I want to thank you again, Dr. Namini, for your time. Everyone else, have a great day.
Thank you so much. I appreciate it.